The biggest problem that I see when I look at this program is the lack of oversight, the lack of accountability, the lack of transparency.
Through a little-known federal funding stream, cities and counties that own nursing homes that accept Medicaid patients can get additional tax dollars meant to improve care for elderly and disabled residents. Over the last decade, state records show these facilities have received $1 billion in your federal taxpayer funds under the program.
With that much money, you would expect that you would see outcomes.
But an analysis by a local law firm shows that since 2017, the quality of care at these facilities has actually been worse than at facilities that aren't receiving all that extra money.
There are real people in here who are suffering.
Why should the federal government pay you more money to not provide high quality care?
I'm investigative reporter Taylor Stevens, and I've been looking into how this program works. I'll explain what the data shows and the pushback we're hearing from Utah's nursing home industry and the Department of Health and Human Services about allegations of poor quality care.
I got gastroparesis, where your stomach kind of dies from not being used for 7 months, and it just led to chronic issues.
Donnie Hunt-Webb is a 55-year-old former social worker and resident at St. George Rehabilitation. She says she sought long-term care due to severe health issues.
The minute I conceived her, I could not keep any food or liquid down.
The nursing home where she now lives is owned by Beaver Valley Hospital, which itself is owned by the city of Beaver in central Utah. This hospital is the biggest participant in Utah's upper payment limit program. With more than 40 facilities, more people now live in nursing homes owned by Beaver Valley than actually live in the city of Beaver. Beaver Valley's nursing homes have received more than $800 million in federal funds, meant to improve care for patients like Hunt-Webb.
It's CNAs, it's extra staff that we don't get.
State records show St. George Rehabilitation has received $20.9 million through the upper payment limit program since 2017. But the facility still has a below-average staffing rating for the Centers for Medicare and Medicaid Services, or CMS. Though data shows its overall staffing has improved slightly since 2017, as has its health inspection rating. But Hunt-Webb, who's lived at St. George Rehabilitation for about 7 years, feels the extra dollars received through the upper payment limit program haven't done enough to improve her care at the facility, and is frustrated after reading a 2017 legislative audit that previously raised concerns about Beaver Valley's administration of the program. It found less than half of the money was making it to nursing homes, with the rest going to administrative costs and program match funding. There are no specific requirements dictating how much of the money must go to direct care.
There's not that many people in Beaver. I don't understand why they're allowed to take the money from nursing homes.
I reached out to St. George Rehabilitation, but they declined an on-camera interview. An administrator told me in an email that they prefer to personally connect with our residents rather than involving the media. The government entities like Beaver Valley Hospital that are part of the upper payment limit program own the licenses for the nursing homes and take a cut of the federal funds. But that doesn't mean they're overseeing day-to-day operations there. Instead, the facilities are largely run by private management companies.
They work in concert with the private corporations because it has to be government-owned in order to draw down on these supplemental Medicaid dollars.
St. George Rehabilitation, where Hunt-Webb lives, for example, is operated by the Ensign Group, a private equity chain with about 300 facilities across the country. As for Beaver Valley,
and they're really only owners in name, right? They're not operating the facilities, they're not there.
All they own is the license, and yet almost half of what the state pays in UPL dollars for my care goes to Beaver.
Hunt-Webb isn't the only one wondering how this money's been spent, as several analyses raise questions about the quality of care at Utah nursing facilities that are receiving these extra federal dollars.
In almost every case, on average, they significantly underperform against the non-UPL facilities.
Barry Toon is an attorney working with the Elder Care Injury Group. The practice group is currently pursuing several ongoing cases filed by individual families against facilities that are owned by Beaver Valley or Gunnison Valley. That's another major participant in the Upper Payment Limit program. An analysis of publicly available federal data the group commissioned found that since 2017, Upper Payment Limit facilities have had worse overall ratings, higher deficiency scores in inspections, and lower staffing ratings, which are based on staffing levels and turnover. While still behind non-upper payment limit facilities, data does show quality ratings and inspection scores have improved slightly in nursing homes part of the program since 2017, while staffing metrics have declined since that time.
When you look at really every available metric to determine are these facilities doing better with the money that they've been given, they're not. They're just not.
I've reviewed hundreds of pages of court filings and found that upper payment limit facilities are facing nearly 20 ongoing lawsuits. In many cases, the complaints were filed by family members who allege that poor quality care led to the death of their loved ones.
A lot of these upper payment ones are not the ones getting the highest reviews, and we're seeing a lot of problems in them.
Nate Krippus is a staff attorney at the Disability Law Center of Utah, which is concerned about conditions at upper payment limit facilities. I think the question is, if that money isn't improving care, where is it going?
I think that is the question.
I reached out to the Utah Department of Health and Human Services and the Utah Healthcare Association, which represents the state's nursing homes. Both pushed back on those analyses, as did Gunnison and Beaver Valley. They declined on-camera interviews, but argued in written statements that it isn't fair to compare Utah's upper payment limit facilities with facilities that don't accept Medicaid patients. That's because they say of the more complex health needs of Medicaid patients. However, the upper payment limit program ensures both types of facilities receive the same amount of funding. DHHS says the most recently released quarter of data shows Utah's upper payment limit facilities have similar overall scores as national ones, including non-Medicaid facilities, and have substantially higher quality scores. Beaver Valley told us the challenges reflected in federal data are indicative of national pressures on nursing homes. When issues are identified at Beaver facilities, they said they're addressed and steps are taken to improve care. They added that upper payment limit is a long game, with the goal of sustained improvements that continue to strengthen the quality of elder care in Utah over time. The city-owned hospital also said lawsuits pending against Beaver Valley facilities represent a small fraction of the thousands of seniors who receive care each year. And they accused malpractice attorneys of misrepresenting the complexity of this program for their own self-interest.
So it brings federal resources to Utah nursing homes.
At a board meeting earlier this summer, Gunnison Valley Hospital administrators read from a document addressing criticisms of the program.
Once critics have understood the goals, process, logistics, and the actual improvement of healthcare provided to Utah's elderly, all at no cost to the state of Utah, they typically and rightly become supportive of the program.
We became involved in the establishment of the UPL program in the state of Utah.
In a Beaver Valley produced video, Utah operators also praised the upper payment limit, saying funds have improved patient quality of life.
Financially, it has been a true blessing to the state of Utah and to those we serve.
Those who remain concerned say they believe the upper payment limit could be a positive for Utah's nursing homes.
The intent behind the UPL program was very good. The idea of providing better reimbursement rates, higher reimbursement rates for Medicaid residents so that you can improve the quality of care is a noble goal.
They just want to ensure the money actually improves patient care.
If anybody needs help and anybody deserves more dollars that go to direct care to take care of those people, it's our elderly population.
We need someone watching. There needs to be accountability of where the money is going.
Tomorrow on Fox 13 News, our Care in Crisis series continues as we explore critiques of spending under the program some say has improved facilities, but not patient care. Taylor Stevens, Fox 13 News, Utah.